was born in 1962, and one of the things I remember growing up was my mum telling me about the concern and fear that she had while she was pregnant with me during 1962. I was born in December, and earlier in that year there was a little global incident known as the Cuban Missile Crisis. And during that period of time, just generally all across the world, people became very, very concerned about what their future was because of the tension that there was between the then Soviet Union and the United States of America. And that kind of percolated forward a couple of years later to the release of one of my kind of favorite movies growing up, that featured an actor, Peter Sellers, and that was called Dr. Strangelove. And its subtitle was How I Stopped Worrying and Learned to Love the Bomb, which is a little play in terms of the title of today's talk. And the concerns that it was reflecting was effectively around this concept of mutually assured destruction. Just since societal anxiety got so wound up that everybody was concerned that the end of the world was nigh, and on from there. So Dr. Strangelove was in some ways a satirical humour release from that concern. If you bring that forward to the topic of this vlog, then you'll see that we have a kind of similar kind of sensation that's occurring. All you have to do is look at the professional media, the general media, anything related to the coverage of healthcare, and there's enormous concern about stress and burnout amongst clinicians just because of the sheer pressure of change and what people are being asked to do, and being asked to do more with less, being asked to gather more information, do more stuff, and is resulting in all kinds of things that I'll talk about in some other vlogs that I've got planned for the future. But essentially it's boiling down to that clinicians are feeling that they're out of control. They can't do a good job, and that stress and ultimately burnout is now reflecting in the quality of their work and the care that they provide to people on a day-to-day basis. One of the factors that's been highlighted quite strongly in a lot of the healthcare information technology news and also in the more general medical journals is the impact that the electronic medical records introduction over the last 10-15 years has had in terms of the workload and the quality of work that clinicians are doing in their day-to-day basis. And there's an enormous amount of focus there that is indicating that EMRs are bad for healthcare, and so therefore they get in the way of doctors' practice and nurses' practice and on from that. And so from that perspective, they don't want to use EMRs anymore, or they feel that they're overburdened, or they could be better, infinitely better. And so there's this enormous struggle going on and a lot of focus in terms of what the EMR is doing to the way that medicine and care is delivered today. But as I reflected on that, I looked a little bit at a study that was done by an organization called KLAS, K-L-A-S. KLAS are an interesting organization. They've been around for a good wee while, looking at basically surveying and consulting on the way that electronic medical records and other healthcare information technology is being used in healthcare. And they're pretty well known for surveys they do about, is this system better than that system? Is this consultancy better than that consultancy? But they did something that, as they were sort of undertaking that work and working with different healthcare organizations, they noticed that there were some patterns that were occurring whereby similar organizations using similar technology were getting very different results in the surveys. And they started to dig into that and decided to engage with some of the healthcare organizations who are their clients and said, can we survey your folks and find out if we can sort of get to the bottom of what is actually going on here? And the results were very, very striking. The survey design looked at a variety of different factors, and three jumped out as the most significant. The first was education in the use of the electronic medical record. What they found was that if there was a very consistent volume of education that was actually sort of provided, and then the quality and the engagement of the clinicians in actually committing to and undertaking the education, there was a significant difference in terms of the quality of the satisfaction of the use of the electronic medical record in those organisations. In organisations where perhaps either the clinicians hadn't reported that they'd undertaken their training, or that they had only done certain amounts of it, online or through some computer-based training using on-screen tutorials, then the degree of satisfaction tended to be a lot less. And that kind of sort of, reflects what you find in other industries as well. If you don't invest both at an organizational level and at a personal level in actually undertaking the training that's put there in front of you, then your results are going to suffer. You're going to find that you're not going to be able to use the EMR as well as you might otherwise do. The other factor that KLAS found when they dug a little deeper into this education topic was that those organizations where ongoing training after the initial deployment of whatever system it was that they were looking at had a very significant effect in terms of the satisfaction that clinicians felt with the systems they were using. And when they dug into some of the best practices, they actually found that organizations that not only required additional training but then embedded it into the day-to-day work of the clinicians who were involved actually had much more significantly better satisfaction and utilization of the system than those organizations who didn't continue to train people as they went on. And again, that actually makes sense from my experience of actually working in the industry, whereby you find that organizations that don't actually take upgrades and use new features that the electronic medical record suppliers are actually making available in their systems tend to stagnate and feel less happy with the way that they're actually using that technology than they would do otherwise. The second factor that KLAS found in the surveys was in the area of personalization. Personalization of the EMR so that it fit your workflow as a clinician, so that you were able to get to the elements that you needed to be able to deliver care, to review a patient's condition, to make decisions about what the plan of care going forward would be. And that related to the capability of the electronic medical record system to be able to deliver that personalization, either at a global level by systems administrators or clinical analysts of some kind setting up the system for the clinicians, or by clinicians themselves being able to change things in their workflow that made a difference for them. The second factor there in terms of personalization that they found in terms of clinicians feeling more satisfied was that they were actually much more interested in personalization of getting information back out of the system, i.e. being able to find filters and reviews and views that gave them what they needed, much more so than being able to have a very customized data entry form or a workflow or a note format, etc. That kind of personalization actually sort of typically would satisfy for a little while, but then it would actually sort of die off a bit and just become, well, that's just how I work and it's now set up, so I'm great. Whereas the retrieval of information was the thing that actually made a big difference there. The third major factor that KLAS found in this study that related to satisfaction and successful use of the electronic medical record related to organizational culture. Culture was a very big indicator of satisfaction when they actually looked at this across all these different organizations who contributed. And the things that were jumping out from the survey were IT and clinical alignment, i.e. the IT or IS department was not seen as being over there and that's them and they kind of look after the system and it's their system. It was very much more about clinicians feeling like they had a stake and an engagement with the IT department, and that the IT department was there to actually enable and support them in their work, much more so than, well, they're over there doing their thing, looking after the nuts, bolts and wires. So that engagement was a very, very critical factor and a leading indicator of whether there was satisfaction or not. Clinician user empowerment was one that came out, and this is really relating to the clinicians feeling that they had a stake in the selection of the system, the deployment and build of the system as it went forward, and then the ongoing use and development and exploiting the capabilities of the system. If the clinicians didn't feel like this was part of their stake in making sure that the EMR was successful, then that typically indicated that they were going to be very unsatisfied. So clinician user engagement to actually sort of be a part of how you be successful in using an electronic medical record. And then the final one, which I hope should be obvious to a lot of the leaders that I'm addressing through this vlog, executive and clinical leadership engagement and commitment and displaying leadership, actually, sort of eating their own lunch, so to speak, in terms of the number of executives who reported that they'd actually gone and undertaken the training themselves. Whether it's relevant to their day-to-day work, at least know and understand what your clinicians and the folks who are employed in your organization are actually experiencing. So that way you can actually show, one, you're committed to this, going through the same process as them, and two, that you get an experience and an understanding of what you've been able to, what they're going through on a day-to-day basis as they try to deliver care. There were some other insights that came from the study. One, IT operating budget was not an indicator of success or satisfaction. When they looked at the variety of different organizations, bigger budget didn't necessarily correlate to satisfaction. There were organizations who were very satisfied, and everybody loves to have a little bit more money and better equipment and things like that. But there were also organizations who had very healthy IT budgets where clinician satisfaction was not high at all. Clinical training in context. This was really related to that ongoing training piece. Being able to do that EMR training or optimization activity during clinical workshops or rounding sessions or departmental meetings was actually a very strong indicator of the EMR being embedded in part of the clinician's daily work and the organizational zeitgeist of EMR is part of how we deliver our care. So that was a very big indicator. And I think that for organizations who don't have EMR represented somewhere in their agenda, departmental agendas, then that's something that would be an easy thing to try and address. There was no correlation between new versus experienced EMR users as far as satisfaction was concerned. So when you had people who were very experienced EMR users, maybe had worked with a previous system or had moved in from an organization that also had that system, there was no correlation between that and new users who the theory was were less experienced and therefore more fearful about using the EMR, and that having an effect on satisfaction. No correlation at all. Younger users, younger clinicians were either the most satisfied or the least satisfied in terms of the survey results. So the younger the clinician, they tended to go to these extremes in the polls, either being more satisfied or least satisfied in the use of the EMR that was deployed there. So KLAS called them the canary in the coal mine. If you remember, canaries were used to detect gas and danger in coal mines. Well, canary in the coal mine is your younger users. So when you do a survey, look at what's actually being said by your younger users, and that's probably a pretty good indicator as to whether the satisfaction in your organization is good or bad. Community organizations were a group of organizations that stood out, and I'm talking about community hospitals, smaller acute care organizations or smaller integrated delivery networks. They all seem to skew more towards the least satisfied of all the different organizational types. And I think, from my own observations, what I would suggest there is that there is some of the factors we said in terms of success tend to be the areas that stress in the smaller organizations. I've actually seen some small organizations in my time who have executed brilliantly and have very good utilization of their electronic medical record, but they tend to satisfy those big three criteria that we were talking about above, irrespective of the resource availability. So from that perspective, smaller community hospital organizations tended to suffer. So what's the call to action? Read the report. Just go and actually, if you're a member of KLAS or your organization subscribes to KLAS, try and get your hands on the report and read it through thoroughly. Look at the other observations that are there, because actually there's some fascinating stuff there. It's still ongoing. KLAS are continuing to keep the Arch Collaborative running as a project, and you can actually subscribe your organization to take the survey, to allow your clinicians to be able to undertake it, get the results back, and then KLAS will allow you to benchmark where you sit amongst the other folks who are participating in the Arch Collaborative, and you'll see how your results stack up. So it's a very, very good way for you to be able to take up the opportunity to participate in this great study and look at how's the health in your organization. Follow their work, either by going to the KLAS website, and I've got the link down below in the details, or following the guy who is leading this, a guy called Taylor Davis, and you can follow him on Twitter, and his email address is actually embedded in some of the slides, and I'll make sure I put it in the details below as well. So follow along what they're doing. Haverin Consulting can help. We've got experience in assisting with governance strategies to help you look at your cultural impact in terms of how you can try and improve the way your organization supports the use of the electronic medical record. We can help by surveying and helping you understand where you may have strengths and weaknesses in terms of your governance structure and how you're engaging with clinicians. We also can help with EMR migration strategies as you look to change. A lot of people have had electronic medical record systems or contemplating changing. We can help with that in terms of coming up with strategies for how should you undertake that change to take advantage of some of these positive lessons learned from the Arch Collaborative report. And finally, looking at content management strategies. As you look to either optimize an existing EMR, or if you are looking to make a switch to a new EMR, having a solid clinical content strategy can be part of how you drive towards getting that personalization executed in terms of giving the clinicians information in their workflow that helps them make better clinical decisions and helps them do it more effectively and more efficiently. So we can do that for you in terms of being able to support and assist you. Contact us at info@haverinconsulting.com. Haverin Consulting, all one word.com. If you enjoyed this vlog, I'll be doing more, covering a whole range of different topics, and I'd be delighted to sort of share some of my passions, some of my interests, and some of the things I've experienced and learned over time working in this industry and a bunch of other places that I've picked up some good ideas from. Subscribe on this link to our YouTube channel, and that way you'll get alerted when I've got a new vlog that goes up. Follow us on Twitter at Haverin Consult. You'll be able to get updates then as to any tidbits of information that I find useful, or when we publish a new blog or vlog. So that's a great place to follow along. This is Stuart Miller, Haverin.